Hello there, folks. Tonight we delve into the wacky world of multiple sclerosis, or MS. MS is an autoimmune disease where the body's immune system attacks the central nervous system. Think of it like this. Your immune system is the bouncer at the club, but instead of keeping out the riffraff, it starts throwing out the VIPs, the nerves in your brain and spinal cord. This can lead to a whole host of neurological symptoms. And yes, dear viewers, that includes pain. Lots and lots of glorious, unpredictable pain. So buckle up, Buttercup, because things are about to get real painful. First up on our pain parade is paresthesia. Ever get that pins and needles sensation when your leg falls asleep? That's paresthesia, but imagine it deciding to set up camp in random parts of your body without the courtesy of a heads up. It's like having a mischievous ghost tickling you from the inside. Then we have dysesthesia, which is basically your nerves playing a cruel game of telephone instead of a clear message like, hey, you're touching a soft blanket. Your brain gets a garbled danger, fire ants, evacuate. This can manifest as burning, freezing, or even a crushing sensation. Not exactly a day at the spa, is it? And let's not forget about pruritus, the fancy medical term for itching. This is the I could scratch through to the bone kind of itch, and it's about as fun as it sounds. Ever heard of allodynia? This delightful little gem turns everyday sensations like a gentle breeze or a light touch into a world of hurt. It's like wearing a suit of armor made of pain receptors. But wait, there's more. MS also comes with its own set of signature pain syndromes, each more bizarre and inconvenient than the last. First up, we have optic neuritis. Imagine your eye is a beautiful, delicate flower. Now imagine someone's yanking on that flower with a rusty pair of pliers. That's optic neuritis for you. Pain with eye movement, often described as a delightful pulling sensation. Fun times. Next on our pain parade is trigeminal neuralgia. This bad boy affects the trigeminal nerve, which is responsible for all the fun sensations in your face, like feeling a gentle breeze or, getting stabbed in the face with a hot poker. People with trigeminal neuralgia experience this lovely stabbing sensation on a regular basis. Then there's l'ermita's sign, which sounds like a fancy French restaurant, but is actually just a jolt of electricity that shoots down your spine and limbs when you bend your neck forward. Picture this. You're reaching for that dropped Cheeto and suddenly, zap, you're the human equivalent of a faulty electrical circuit. And let's not forget about intercostal neuralgia, which is basically a chest pain so severe it feels like you're having a heart attack. Section 4, bonus round, painful surprises you didn't ask for. But wait, there's even more fun to be had. Because MS is a generous lover of pain, it also throws in a few bonus rounds of discomfort. Let's talk about spasticity, shall we? Imagine your muscles are having a never-ending arm wrestling match, except there's no winner, just constant stiffness and spasms. It's like your body is trying to do yoga in a straitjacket. And then there are the UTIs. Yes, folks, MS can even make peeing an adventure. Imagine having to pee all the time, but each trip to the bathroom feels like you're passing shards of glass. But wait, there's more. MS also loves to party with migraines, those delightful headaches that feel like a tiny goblin is hammering on your skull while a marching band practices inside your brain. And let's not forget about joint pain. Imagine your joints are like rusty hinges on a door that hasn't been opened in decades. Section 5. Treating the ouch, a comedic approach. So, how do you treat all this delightful discomfort? Well, it's not always easy, folks. Narcotics? Not so much. They're about as effective as a screen door on a submarine when it comes to MS pain. But fear not, brave warriors of discomfort. There are other options. Steroids are like the firefighters of the medication world, rushing in to put out the flames of inflammation. Anti-seizure medications are like the cool older brother who tells the pain to chill out. Antidepressants are like the therapist who helps you cope with the emotional roller coaster of living with chronic pain. Muscle relaxants are like a massage for your spasming muscles, and Botox injections are like a temporary restraining order against those pesky muscle spasms. Section 6. Laughing through the pain, finding humor in the unexpected. So there you have it, folks. A crash course in the wonderful world of MS pain. It's unpredictable, it's frustrating, and it can make you want to pull your hair out, which ironically can also be a symptom of MS. Since no two MS patients are alike, which is why it's called the snowflake disease, Life with MS is, in the words of Forrest Gump, life is like a box of chocolates. You never know which painful symptom you're going to get, or you could be one of the lucky ones and have very few painful symptoms. But it's also a reminder that life is full of surprises, and sometimes the best way to deal with those surprises is to find the humor in them. Because let's face it, folks, when life gives you lemons, you make lemonade, and when life gives you MS, you make MS jokes.